break down what those simple 7 steps are and how they can improve any of your chances of not getting heart disease.
Sure. So the Life Simple 7 was a program developed by the American Heart Association, which in 2010 tried to come up with 7 simple factors that each individual can focus on responsibly that would allow them to reduce the likelihood of them developing heart disease, which also ultimately will wind up having them not only reduce the likelihood of them developing heart disease, but also all chronic diseases like cancer, diabetes, chronic lung disease, obesity, etc. This is our medical dashboard. Your blood pressure, systolic, which is the top number, which is the number that of your blood pressure when the heart contracts, and diastolic, which is the bottom number, which is when your heart's in a relaxed state. So the blood pressure is the first medical dashboard number. Your cholesterol, and we talked about the fact that there are 4 cholesterol numbers: total cholesterol, good cholesterol, HDL, bad cholesterol, LDL, and triglycerides. So when we talk about cholesterol, you really need to know all 4 of those numbers, and your blood sugar. Okay, and those are your medical dashboard numbers. So that's 3 of Life Simple 7. And then your 4 lifestyle numbers, which of course impact your medical dashboard numbers, are nutritional status, which is basically eating the right kinds of foods, certainly lots of fruits and vegetables, lean protein, complex carbohydrates. Your activity level, which is exercise and involves, in a sense, going to the gym, but really involves movement. And the American Heart Association has designated 10,000 steps a day as what would be considered ideal movement. And that's from the time you get up in the morning to the time you go to bed at night. And that's 10,000 steps is about 5 miles of movement a day. The next is your smoking status. Obviously, the ideal status is to never have smoked and not to smoke. But if you have smoked, to be a former smoker. And if you're an active smoker, that's obviously something we want to stop. And then weight. And weight is divided into 3 groups: ideal weight, overweight, or obesity. And obesity comes in mild, moderate, and morbid obesity.